If you're over 60 and your dog sleeps beside you every night, please don't skip this. This isn't a random habit, it's not just comfort, and it's definitely not something to ignore. For many seniors, that quiet moment when your dog curls up near your chest or legs feels like safety, love, and companionship. In fact, for some, it's the only warm presence they feel all day. Your dog isn't just sleeping, they're guarding you, watching your breathing, listening to your heartbeat. But here's what most people don't realize. This nightly habit can either protect your health or slowly harm it, depending on what you know and what you don't. Doctors, sleep researchers, and veterinarians have all noticed something surprising about seniors who share their bed with a dog. Some experience deeper sleep, lower anxiety, and even better heart health. Others, without realizing it, face hidden risks, respiratory issues, joint pain, disturbed sleep cycles, and even weakened immunity. The difference isn't the dog, the difference is awareness. So before tonight comes and your dog jumps onto the bed again, there are a few things you need to understand, because this habit may be telling you something important about your body, your emotions, and your health. Let's start with the part no one talks about enough. Your dog sleeping with you may be helping you emotionally more than any medicine ever could. After 60, loneliness becomes one of the biggest silent threats. Children grow busy, friends move away, spouses may pass on, and suddenly, nights feel longer than days. When your dog chooses to sleep beside you, it's not random, it's emotional bonding. Dogs are pack animals. They sense vulnerability, they sense loneliness, and they respond with closeness. Studies show that seniors who sleep near their dogs often have lower cortisol levels. That's the stress hormone. Their heart rate stabilizes. Their mind calms faster. Nighttime anxiety reduces. For many, that gentle warmth and soft breathing acts like a natural sleep aid. Emotionally, this routine gives your brain a powerful signal. You're not alone, and that matters more than people realize. Chronic loneliness has been linked to memory decline, depression, and even heart disease. Your dog's presence can interrupt that cycle, night after night, without saying a single word. But emotional comfort doesn't mean the habit is automatically safe. Emotional relief can sometimes mask physical warning signs, and that's where the next part becomes critical. Now comes the part most people avoid talking about, but you deserve the truth. As we age, our immune system naturally weakens. Our lungs become more sensitive. Our joints take longer to recover. When a dog sleeps in the same bed every night, certain risks quietly increase, especially if precautions aren't taken. Pet dander, microscopic bacteria, and allergens can build up in bedding. For seniors with asthma, arthritis, diabetes, or heart conditions, this can worsen breathing at night or trigger inflammation without obvious symptoms. Many older adults complain of unexplained fatigue or stiffness in the morning, and never connect it to disrupted sleep cycles caused by subtle movement or heat changes from their dog. There's also balance and safety. A dog sleeping near your legs increases the risk of nighttime falls, especially if you wake suddenly to use the restroom. For seniors, a single fall can change everything. This doesn't mean your dog shouldn't sleep near you. It means the habit must be adjusted intelligently. Clean bedding routines, regular dog hygiene, proper sleeping positions, and awareness of your own health signals make all the difference between comfort and risk. Here's something fascinating. When a dog insists on sleeping close to an older person, it's often a response, not a preference. Dogs can detect changes in breathing, blood pressure, heart rhythm, and even emotional distress. If your dog presses closer than usual, positions themselves near your chest, or reacts when your breathing changes, it could be protective behavior. Some dogs do this instinctively when they sense vulnerability or instability. For seniors, this can be a subtle signal to pay attention to their own health. Increased fatigue, restless sleep, irregular breathing, emotional stress. Your dog may be responding to something you've learned to ignore. At the same time, your dog may also be seeking reassurance. Aging owners often move slower, breathe differently, or experience temperature changes during sleep. Your dog senses this and adjusts their position as a form of bonding and guarding. This is why pushing your dog away suddenly or scolding them for this behavior can create anxiety in them and emotional stress for you. Instead of reacting, observe. Your dog may be offering comfort or raising a silent alert. Either way, it's worth listening. So what's the right choice? Not separation, not guilt, but smart balance. If you're over 60 and your dog sleeps with you, the safest approach is controlled closeness. Keep your dog clean and groomed regularly. Wash bedding weekly. Allow space near your legs and feet to reduce fall risk. If you have breathing issues, keep your dog closer to your side, not near your face. Most importantly, listen to your body. If sleep improves, anxiety reduces, and mornings feel lighter, that bond is helping you. If you wake exhausted, sore, or short of breath, adjust the routine. A nearby dog bed beside your own can preserve emotional comfort while protecting physical health. Your dog doesn't need to be on you to protect you. They just need to be near. That quiet presence, warm, loyal, watchful, can be one of the greatest comforts of later life. When managed wisely, it becomes a source of strength instead of risk. Tonight, when your dog curls up beside you, don't just feel the love, understand it, respect it, and use it to live better.